So now we're staying in the intestines and we're going to necrotizing enterocolitis, which I want you to think immature inflamed bowel. This affects our newborn clients and most particularly our premature newborns, which have immature GI tracts. So what happens is when there's an immature intestinal wall, the bacteria can grow and it can become inflamed, and that can lead to deadly necrosis. So our major complication with these clients is bowel perforation. So what do we see in these clients? We see abdominal distension because of that inflamed bowel, and that's usually an early sign. We also see bloody stool and vomiting due to that bowel inflammation as well. So next we need to monitor and prevent this by monitoring that abdominal girth. Remember, that is usually the first sign of necrotizing enterocolitis. We need to report it right away if it's increasing. Then reporting signs of bowel perforation, which is also indicated by increased abdominal girth and abdominal rigidity. We need to avoid rectal temperatures because remember, NCLEX tip, they're at risk for bowel perforation. Any client at risk for that should not get rectal temperatures because that probe can perforate that bowel. Bowel rest and antibiotics. Because we don't want to introduce any food into that inflamed bowel, we need to make them NPO right away, and we need to administer IV antibiotics to fight that bacterial infection. Then we need to insert NG or OG tube to suction to decompress that inflamed bowel.